It's a really great alternative treatment for people that have, one, been treated with steroids in the past, or two, have been offered steroids for arthritis or for a tendon-related injury, but are not quite sure it's the right thing for them. My name is Dr. Erik Nelson, and I'm a naturopathic doctor here at Neurvana Naturopathic Medicine. Cortisone injections is a very, very common pain relief technique. It's used around the world because it's got a pretty good safety profile. We know how it works. We know that it can be effective in some pain conditions. It's one of the only things that your primary care physician will offer you as an alternative to surgery. So it's one of those things that can kind of be a stopgap for our patients that are in pain. Cortisone, when it's injected into a tissue, does two main things. The first is that the inflammatory process is completely shut off. Typically speaking, if your pain is coming from an inflammatory condition, so if you have arthritis that's active, if you have tendonitis, for example, or plantar fasciitis, anytime you hear that word itis at the end, that's actually an inflammatory condition. So something like cortisone injections can be useful to decrease the inflammation part of that. And it really is a blunt tool. It turns off the inflammation and it impairs the immune system's ability to respond to any injury in that tissue for up to 3 to 6 months. Sometimes it doesn't stick around and act that long, and I know many of you have been there where you've had a cortisone injection and it gave you your life back for 4 weeks, 2 weeks, 6 weeks, and then all of a sudden all of your pain came back. And that's because the medicine wore off, your immune system recovered in the area, and inflammation came back quickly. And the reason it comes back quickly is because it doesn't actually treat the cause. It doesn't change the underlying tissue, it doesn't change the underlying injury. And honestly, there is a point where steroids just stop working altogether, and I'm sure many of you are already at that point. And that's really where I want to give you an alternative. The other thing that cortisone injections do is that it actually stops the production of new collagen. Collagen is really, really important for normal healing, normal repair, and the fact that cortisone injections stop that is actually one of their downsides. There was a study not too long ago looking at the 10-year history after getting a series of steroid injections in common joints. And they compared those to people that were getting injections of saline, and they found that the people that got the steroid injections actually had faster degeneration and deterioration in that joint at the 10-year mark. If the cortisone works really well for you, you're now in a position where you feel better than you did before, and now you're walking on your injured tissue, you're picking up your kids and not thinking about your back, for example, but the underlying tissue is still injured. You just can't feel it. Not only that, if you stress that underlying tissue and it needs to produce more collagen in the area, that cortisone is impairing that ability to lay down new collagen. It's providing some sort of a short-term benefit, but at the expense of some long-term potential complications. One of the most common alternatives that I talk about with my patients is something called Prolotherapy. The two main points that I made before about steroids are, one, that steroids decrease the inflammatory process and turn off the immune system in that area. The second thing they do is it decreases collagen production, especially in tendons. Prolotherapy is the exact opposite. In fact, it increases and ramps up the immune system's response to a potential damaged structure that didn't heal right the first time. The other thing it does is it actually ramps up collagen production in tendons. So it's a really great alternative treatment for people that have, one, been treated with steroids in the past, or two, have been offered steroids for arthritis or for a tendon-related injury, but are not quite sure it's the right thing for them. One common drawback to getting corticosteroid injections is if you are a diabetic patient or you're somebody who struggles with your blood sugar control. There is a short-term, well-known effect when you do get an injection of steroids. You'll probably have a worsening of your blood sugar control. A nice alternative like prolotherapy does not have any effect on your blood sugar. I think that's a very valid reason to choose prolotherapy over cortisone. If any of the things I just said or taught you about are interesting to you and they think that it applies to your life, click on the link below. I would love to have a consult with you, talk about your options, give you more detail, give you more information in office, and help you get off of that cycle.